Hi, this is Brendan Cronin. This is all the information that you need to make your post-PRK recovery as quick and as smooth as possible. Right now you are probably sitting in the recovery area of the Southbank Day Hospital and probably just want to go home. Unfortunately, you do need to stay for a set period of time as per hospital guidelines. Just lie back and have something to eat to pass the time. Your post-operative drops are really important. You will have three main types of drops: antibiotics, anti-inflammatory or steroid eye drops, and lubricating artificial tear drops. It's absolutely critical that you use them to ensure a routine recovery. This includes the lubricating drops. Even if you feel that your eye is constantly watering for the first few days, make sure you use your lubricants. Many people incorrectly stop the lubricants when the antibiotic and steroid drops finish. Please keep them going. Everyone gets dry eyes after the procedure. Some people will feel this as a dry, scratchy sensation, but most people notice it as blurred vision that clears up when they blink. Some people will even have excess watering because the tear layers are not in balance. This dryness tends to last 6 to 12 weeks. Use the lubricants as instructed to help the dryness to disappear faster. Using these is really important for a good visual recovery. It is important that your eye drops are 5 minutes apart so that one drop has had time to soak in so that the next drop doesn't wash the first one out. The eye can only hold one drop at a time, so there is no need to worry if you use more than one drop, but there's no advantage in doing so. Sometimes in the first few days when your eye is really uncomfortable, it can be hard to do the drops yourself. If this is the case, get someone else to do them for you, and always use the lubricating drops last. You will be given a written version of these instructions. It has a tick box sheet on it to make complying with your eye drop regime easier. If you prefer, there are also apps for your phone that will remind you when your drops are due. Your drops only need to be roughly evenly spaced over normal waking hours. You do not need to wake up to do drops. However, many people use the lubricants overnight in the first few days, as their sleep tends to be disturbed anyway. You will also have a small fourth eye drop. This is local anesthetic. It will either be called tetracaine, amithecaine, or oxybuprocaine. You will only have one of these. Local anesthetic will make your eye completely numb. It should feel great when the drop is working. This lasts for about 20 to 30 minutes. The problem is that local anesthetic also impairs healing, so it's a bit like hitting pause on a bad movie that you have to watch the end of. So the important point here is that yes, you can use the anesthetic drop, but try to only use it once or twice, and even then, use it for something like making you comfortable for a shower, a meal, or to help you get to sleep. You can recap the container, but you must discard it 24 hours after you open it. Everyone gets a sore and painful eye after their PRK. Sometimes the pain won't start for a few hours after the procedure, but it will start. Stay ahead of the curve. Don't wait for your pain to start and then take your pain medications. Take the medications before the pain begins so that the pain never gets too bad. Most people will have two pain medications, Targen and a combination tablet containing paracetamol and ibuprofen. Your Targen dose may be 1 to 2 tablets. Check the box as the dosing may be different for different people. Rarely, patients will develop nausea or vomiting after the procedure. If this occurs, it will almost definitely be from the Targen. Targen is an opiate medication like Endone. This can cause nausea. However, Targen includes a medication to generally block this side effect. Despite this, occasionally people will still feel unwell. If nausea or vomiting become an issue, try stopping the Targen. It can take 12 hours for the nausea to settle. Please contact me if your symptoms are severe. Most patients say that if they are in bed with both of their eyes closed and that they have had their oral analgesia, then they were either reasonably comfortable or mildly uncomfortable, but not in pain. It's when you try and do more than this that you get into trouble. You will normally have a bandaged contact lens inserted in your eye at the end of the procedure. These lenses are designed to act like a bandage and smooth over any rough parts on the surface of the eye. If this contact lens falls out, leave it out. If your contact lens is irritating and you're happy to remove it yourself, then feel free to do so. So what can you do and can't you do after your procedure? You can shower and wash your hair as you normally do. You can exercise and return to normal activity as soon as your pain resolves. And you can look at a computer, phone or tablet or even read a book. In reality, however, most people don't really want to do any of these things for the first few days. So what can't you do? No eye makeup for the first 7 days. It can harbour germs. No swimming for 14 days after the procedure or until you're given the all clear at your 1 week check. And no driving until your vision is back to normal. So what does a typical recovery look like? And when can you return to work? Generally, you are pretty sore for 72 hours. This can be very variable, as some people recover remarkably quickly and others more slowly. You won't want to do much during this 72-hour period. Usually, by 72 hours, your eye won't be painful, but it will be irritated, scratchy, or uncomfortable, but not usually painful. Your vision will still be blurry. By the 4th day, which is usually Monday if you had your procedure on Thursday, most people are back at work, but they still have slightly blurry vision. Obviously, this will depend on your profession, how clean your work environment is, and what your visual requirements are. Remember to continue your drops. You must religiously wear appropriate sunglasses for 3 weeks after the procedure, and then wear them regularly for 3 months after the procedure. This helps to avoid a complication called corneal haze after your PRK. So what are appropriate sunglasses? You will be given a pair in the post-operative area of the South Bank Day Hospital. These certainly fit the bill, but they're not stylish. There are 2 important things that your sunglasses need. The first is that they must meet the Australian UV 400 guidelines. All sunglasses that are sold in Australia are supposed to meet these. Second of all, you really need some side protection in the sunglasses, so not aviators, something with either a thick sidearm or else a little bit of a wraparound to them, but they don't have to be uncool. You can still keep it stylish. Your optometrist will normally be able to recommend a very good pair of sunglasses for after your laser surgery. Thankfully, emergencies after eye procedures are extremely rare. If you feel you do have an emergency following the surgery, please use the contact details provided in your post-operative booklet. Small issues are much more common, and these will often happen over the weekend. If you feel you do have a question or a concern, please feel free to send me a text message, even if it's after hours. I find people are more inclined to ask questions or raise concerns if they feel they can just send a text message. I only ask that you include your full name, the procedure that you have had done, and the date that you had the procedure performed. I won't have your contact details in my phone, so this enables me to answer your query more quickly and allows me to look up your medical record if I need to. And to harp on the dry eye point one more time, everyone gets a dry eye after laser surgery. This is exacerbated by the fact that most people having the surgery do so because they have issues with contact lenses and dry eyes already. Some people will feel a classic dry, scratchy sensation, but most people notice it as blurred vision that clears up when they blink. Some people even have excess watering because their tear layers are not in balance. This dryness tends to last 4 to 12 weeks. Use the lubricants as instructed to help the dryness to disappear faster. Again, using these is really important for good visual recovery. Some people need additional measures to improve their dry eyes. One simple and easy one is taking a high-quality oral omega-3 supplement. Fish oil or krill oil are very effective options for this. If you are vegan, try an algae-based omega-3 supplement. Taking the omega-3s for a few months after the surgery can really improve longer-term dry eye symptoms. I hope you recover very rapidly from the procedure and get back to your normal life and normal vision as quickly as you can. It's always nice when the procedure is finished and the discomfort has completely resolved. If you have any ideas on how the process can be improved or any feedback, I'm always happy to hear that. Just drop me a line or send me an email.